Yes, we are live, Arif. Please proceed.
Okay, thank you very much, Rashid, and Assalamu alaikum, and a very warm welcome to all our listeners within the ACCA community and beyond. We've got with us a couple of very highly qualified doctors here today from the medical profession. So it's an interesting sort of interaction we're going to have between two professions. You know, we've got the accounting profession, who are very much focused on financial reporting, budgeting, management reporting, and we've got people who really are at the coalface of you know, the medical profession and are dealing with people's health. You know, so we are primarily concerned with people's wealth, but the doctors here are very much concerned with people's health, and you know, and often there is a connection between the two, and both at an institutional level and also at a personal level as well. So let me introduce my two guests here today. First of all, let me introduce Dr. Zia Ur Rehman, who is the Chief Executive of, sorry, let me
Northwest General Hospital.
Yes, we've got the Chief Executive of Northwest General Hospital, Peshawar. Dr. Zia, would you like to introduce yourself so that I don't make any errors?
Well, I'm an anesthetist by training and qualification, and over the last couple of years, I've transitioned into administration, and I work as a chief executive now at Northwest. I've been out of Pakistan for about 30 years and returned only 3-4 years ago.
Great, thank you very much. Professor Dr. Abdul Latif Khan is our other guest, and he's also the Chief Executive Officer at Lady Reading Hospital, which is a very well-known name across Pakistan. Professor Dr. Abdul Latif, would you like to just say a little bit about yourself, Dr. Abdul Latif?
Thank you very much. Just as the rest of us, I did all my training in the United Kingdom. I trained as a laparoscopic colorectal surgeon. And after finishing my training, I was consultant in Scotland. And after spending about 13 years there, I was offered a very lucrative job in Saudi Arabia, where they wanted me to develop laparoscopic colorectal unit in King Faisal Specialist Hospital, Jeddah. I spent about 6 years there. I did all my best, and we had a very robust laparoscopic colorectal unit. And then one day I decided I wanted to come back home. And when I came back here, I was offered this job here as Chief Executive Officer, Dean, and Professor of Surgery. And that was over a year ago. Although I had done quite a bit of management at consultant level, but this has been a new experience to me. It has been a wonderful 1 year, very challenging, full of excitement, and we are doing our best to lift the standards of the Lady Reading Hospital, which already is very high standard, high quality. But we are trying to bring in new ideas from our experience outside. So that's my resume. Thank you.
Thank you very much. And I think, you know, one thing that all three of us, it just turns out that we have in common is that, you know, that we're those Pakistanis who've spent time abroad, and we've been exposed to capabilities in very developed markets, and through a sense of belonging, or you know, we've all come back and we want to contribute to the nation building here, whether it's the health sector, whether it's the finance sector. So let me start off with Dr. Zia and both you, Professor Latif, at the same time. Let's just talk about the current situation here. You know, we've got the spread of a pandemic, you know, and what we've realized immediately is that the nation's health and the nation's economic prosperity and economic stability are interdependent. There's no way that you can have a growing economy and a stable economy unless you have a healthy environment free from these lethal viruses. In just a minute, just sum up for me your summary of how the pandemic is affecting communities, how it's affecting the workplace, and how it's affecting the economics. Dr. Zia?
Yeah. I think the pandemic took everybody by surprise. Nobody was prepared for it. And like we usually do, we were not willing to accept that this thing has happened, like the usual state of denial. And I think in some places it's still not sinking in properly. It has a huge impact on the medical profession. One, the first thing, I'll talk more about private sector because I'm in the private sector. People are scared coming into the hospitals. So the businesses have significantly reduced inputs. And at the same time, you have to start catering for the pandemic. Now, to be able to do that, it's a very, very costly exercise. You have to get all new equipment, you have to hire extra staff and all that. So all in all, it had a very negative financial impact on private institutions. I think government sponsored institutions are a bit different because they get the grants. But for us in private sector, whatever you provide, you have to generate the revenue for it. So initially it was very, very hard to be able to sort of, come to grips with it. Sort of planning was the hardest bit. How do you cope with it? I think that was the hardest bit for us. Then once we streamlined all those bits, then came the financial aspect. And we have been very lucky that although we were not in a state to do it, but we managed to have a very sound base of services provision for the affected people.
Right, so that's a very interesting proposition that you've made, Dr. Zia, in the sense that obviously because you are a private hospital, so you have to balance the services with also meeting a minimum level of financial health as well. Professor Abdul Latif, you are a public sector hospital, yeah. But the question was a little bit different in the sense that how do you see, the livelihoods argument versus the life argument? Which comes first? Do we protect ourselves and our families and our communities and sacrifice economics, or do we strike a balance?
I think we really have to strike a balance here because the government of Pakistan, I think, did very well. They recognized the enormity of this problem. And we were lucky in the sense that the rest of the globe had experienced it before us. So we could learn from their experiences as well. Just as Dr. Zia said, it came as a big shock. It is still a big shock. And we had strange experiences at the start and even now. My personal assessment is, and I'll come to the life and livelihood in a second, if you allow me a few minutes. There were three different types of reaction that came out very obviously. One was the reaction of disbelief by general public, and I think there's still a big proportion of people who think it is not true, it's not a fact of life. And these are people who are living in the villages, and that's their belief. The second one was the healthcare workers, and that was quite surprising because we as healthcare workers, we are used to dealing with the patients with all sorts of risk factors associated with it. And we never think twice. I'm a surgeon and I operate on many people who suffer from AIDS and hepatitis C, all sorts of problems. And we take the precautions, necessary precautions, and we get on with the work. But here we faced a situation where the healthcare workers were actually scared of going anywhere near the patients. And it was an element of fear which was unbelievable. And we took a long time. We had to give psychiatric sessions, psychological sessions, counseling sessions, all sorts of things to try and take this fear away. And then there was this third strange type of reaction, and that was coming from vested interest. And these were the people who were spreading all sorts of lies and rumors about patients being killed in a hospital. If you go to hospital, they'll give you an injection to kill you. And strange enough, a lot of people believe in that. And especially in KPK, where we have a huge rural population, those people tend to believe. With the end result that when we got the patients here, and LRH is the biggest hospital, is the busiest hospital, and it's the oldest hospital of KPK, we were getting patients basically moribund reaching our gates. So within few minutes or hours of entering the hospital, they were dying. And that was because of fear. The people will not bring their own patients till they were actually end stage. So that was our biggest problem. And we went on the media many, many times to try and allay this fear, this strange sort of phenomenon, which we are still struggling with. So coming now to the life and livelihood, I think we did very well. We recognized that it was not just this corona problem, which is life-taking problem, but there are people, there's a lot of poverty in Pakistan. And if you were to shut them down completely, you can imagine the disaster that would have happened even then. So I personally endorse what our government has done. We were the first hospital in KPK. We closed our elective services for fear of spreading it. And right. So I think we have done well.
So, there's some very interesting points which have been brought up. And one of them, what sounds like to me, and this is something that the accounting profession and the medical profession share, that, there seems to be an expectation gap between what the public demands and what the medical profession is able to deliver. Right? So, and as a result, there's a trust deficit. जो आपने अभी mention किया ना, that the public don't trust the providers of healthcare, that there's a trust deficit. हम इसको ये polio drops के भी जो policy है उसमें भी देखते हैं that ये trust deficit है. So, Dr. Zia, this trust deficit that has arisen, the medical profession, from your point of view, what does the medical profession have to do to restore the trust deficit?
I don't think I would necessarily put it as a trust deficit. Like Latif Saab was saying that they shut elective procedures or clinics or everything in Lead Reading Hospital. We looked at the problem differently because Corona is not the only problem in the community. There's people who've got heart disease, people who are diabetics, people who need other kind of medical care as well. So we never stopped our elective services. We carried on with our elective services, provision of services to people. And at the same time, we started services for COVID as well. So I think life versus livelihood is not a question. In the medical profession, life comes first.
Right.
At any cost. We didn't have the finances, we didn't have the thing, but we still pulled the money from different places and got the system up to scratch to be able to provide services. I think the inherent problem is with the understanding of the masses. I went to the village and people were coming and I just sort of waved to them rather than shaking hands. And everybody comes and embraces you. And I said, look, this thing is no good. Corona is, you should be careful. And the perception is it's not a disease for the Muslims. We pray 5 times a day, we do wuzu 5 times a day. So Corona doesn't say anything to us. So it's not medical profession that they don't trust. It's the lack of understanding of the actual disease itself. And then, because like Latif Sahab was saying, they come to the hospitals at terminal stage. So most of them, when they arrive, they are moribund and they die soon after coming to the hospital. And, when they come at that level, you have to do all sorts of things, medications, drips, lines, everything. And then when these lay people look at these things, they're saying, oh, look, these guys are giving them these injections, and these injections are killing them. So this is, I don't know about Punjab, but in KP, this is a very common thing, where they say you go to the hospital, they give an injection and you die. So don't go to the hospital. So there is the lack of understanding of the disease process itself. I've known a few people related to me who were sitting at home for 10, 12, 15 days with symptoms, just scared of coming to the hospital. And eventually they did die. So it's not that they were scared of the doctors or the hospital. They just were in denial that, I'll be okay. Nothing's going to happen to me. So I think this is the basic problem, rather than a trust deficit in doctors.
Right. The other thing, Professor Latif, before I come to you is, the accounting profession, like I said, also has a expectation gap. And there have been financial failures in the past, Enron, WorldCom, where a lot of people lost their jobs, lost their livelihoods, they lost their savings as a result of a failure of the audit profession. Yeah, a lack of integrity within the audit profession. Now, it was up to the audit profession as well as regulation, external regulation, to restore that trust. Yep. Does the regulatory mechanism around how doctors operate and how they deliver their code of ethics as well, does that need to be better articulated? Do doctors have to, like we have to in the accounting profession, we have to have a CPD, continuous professional development, so that we can keep up with the latest technical releases, the latest laws, the latest regulatory frameworks. आपके profession में भी ऐसे ही होता है that आप भी you have to keep up to date with latest medical treatments, etc., etc.
Sorry, are you asking me?
Yes, yes, Professor Latif.
We certainly have. It's a very robust system.
And what about? Yes.
Sorry, we just cut off for a second. And we have audit system as well. I must say, as I said, I've been here 1 year. The system of audit and the accountability in Pakistan is not as advanced as it is in the United Kingdom and other places. For example, the mortality meetings are taken much more serious in the United Kingdom and European countries. That was something that was lacking a little bit here. Once Corona started, and because LRH only receives the really serious patients, we don't accept the mild cases. So we are talking about high mortality. And so when this started, the media picked on this and started producing all sorts of negative publicity, and quite often it was untrue. So I'd made sure that we started mortality meetings very regularly. We looked at all the mortalities, discussed them in detail, and then we gave a feedback. One thing I really like to add here also is, as you are very well aware, the violence against healthcare professionals has been on a rise for the last few decades in Pakistan, and people have been trying to address this issue. This became a bit more obvious after Corona started, and there were a few reasons for that. One was because of the status of patient, the families were not allowed to be in the intensive care or high dependency units with them. And so again, and there was certain influx of these patients that even for medical faculties to keep pace with all these things was a bit difficult. And so there was a little bit of miscommunication or lack of communication. We recognize that, and now we have telelinks of all the patients in intensive care and HDU to the patient's family, so they can actually talk to the patients and know their welfare and everything, and how doctors and nurses are putting their lives at risk looking after their patients. And then we have family counselors who actually sit in the same room while they are talking to their patients and families, who will update them with the medical stage as well. So that's made a huge difference. We find even in the last few weeks that people now, they are aware, they have knowledge about things. So hopefully that will go back to the community and spread something positive about us.
So let's talk a little bit about demand and supply, because we've all had exposure to the West, to developed countries, where the demand for health services is from the general public, and the provider of health services is normally the state, the government. So yes, there is a private sector health system, but generally the vast majority of health services is provided by the state, and it's financed through taxation. So the government collects taxation. It gives, in the West, I think they give almost 20% of the GDP to health services. So it's very well financed, it's sustainable, and there's good quality healthcare. In Pakistan, we have a demand and supply gap. The demand is much greater than the supply of state health services. To fill the gap between demand and supply, we have a very active and reasonably good private sector healthcare, which is trying to fill the gap. Yeah, but the thing is that there is still a starvation of the national health system in Pakistan because of a lack of funds. I think only about, according to the World Bank data, only about 3% of our GDP is going into the National Health Service in Pakistan. Considering the population of 220 million people, what is the long-term impact if we continue to only give 3 to 3.5% funding to the national health sector? What does that mean for us in the long term? Perhaps Dr. Zia, I can start with you and then move to Dr. Latif.
Before I come to this question, I just would like to add a bit to the previous one that you asked, Latif Saab. There's a basic difference in the training of doctors in Pakistan and the West. There's a lot of emphasis on quality provision of services, self-auditing, reporting and all that sort of stuff, which is not part of the training in Pakistan. And that is the biggest issue. You get people who complete their postgraduate training, get their degrees, but they're lacking on that aspect. That's number one. Number two is the regulatory bodies, which they have, they are certainly doing a lot more than they were in the past, but still they're not streamlined. And there's a lot to be desired in the regulation of health services. To the new question, 3% is nothing. Medicine is very, very expensive these days, as you all know, and 3% will not do anything. Now, the other problem that we face here is that private and public, they complement each other. Here, they're considered as rivals. When the pandemic started, we approached the government ourselves, KP, and we offered them 200 beds free of charge. We said, look, we've got these 200 beds. We can give them to you for corona patients. The hospital won't charge you any money. We've got a social and corporate responsibility. We will give you these 200 beds. You can utilize them for the care of COVID patients. Now, the thing started off, we'll do this, and now it's done, and it's finally start admitting patients. But the planning is not there. And that is the biggest problem. When I was in Australia, they set out a obstetric team unit. They had specialists and they rural specialists and all these people, statisticians and demographics and everything. And they were planning that what will be the birth rate in 30 years' time. So they worked out those things and they started preparing from now for 30 years after. So when you come to that stage, you're all ready. Here we don't have that, with all this terrorism and all that, you would expect that all hospitals would have major disaster plans and they would be financed and they would be sort of ready to go. It doesn't happen. I think Lead Reading is probably the only hospital because everything comes there. So they've got a lot of experience in that. But other than that, if you go to any other hospital, there's no planning at all. So unless we get our planning correct, this thing is going to get worse. I give you an example. I was at one of these SDG meetings with the Department of Health. And their analysis was that, for the city of Peshawar only, we need 18,000 hospital beds just to look after Peshawar, the people in Peshawar. And the total number of beds, private and public combined, is 12,000. So you can imagine we're 30% short of beds already. And this is for the population of Peshawar only. We drain the whole province. From everywhere people come. So there's at least 70-80% more burden on it. So where are we going to end up? I don't think that if we carry on like this is sustainable.
So एक तो आपका message ये है that we need better planning, better long-term planning, and planning that is insightful, that takes account of your future pattern of changes which are going to happen in Pakistan. Professor Latif, इसी पे ही रहते हैं. वो अगर हमारी अभी population जो है वो 220 million है, वो उस 220 million में 100 million जो है वो under the age of 30 है. Right? So आपका जो future aging population जो होनी है, that is going to be quite significant. और अगर life expectancy भी increase हो रही है, right? और ये नई बीमारियां आ रही हैं, right? Then how can you possibly sort of sustain a level of service with a 3% contribution from the state?
Well, certainly 3% is too low a percentage for healthcare. That's one thing for sure. The expectations of public is rising by the day from the health services. I think it's not just the lack of money that is thrown at the health service. It is also the lack of planning, and the policies are quite often defective. If I just take the example of tertiary care hospitals and the district general hospitals, BHUs, these are the basic health units, and Tehsil headquarter hospitals, the majority of patients that we see at LRH, which is a tertiary care hospital, about 80% of these patients do not need to be here. And these are people who are traveling from far-flung areas where these basic units are not given any attention by the government whatsoever. So it is clogging our system in the tertiary care. So instead of providing exemplary treatment to the patients who actually require the treatment, we are looking after basically in LRH, we see almost close to about 10 to 12,000 patients every day. And 80% of these patients do not need even to be here. They could be treated in villages and basic health units and things like those. So I think the government is throwing some money at the tertiary care hospital, but not realizing the problems. And we have told them on many, many occasions that our main problem at the moment is the bulk of patients that we are receiving here. And so they could actually improve. And what are the reasons why they don't improve? First of all, the infrastructure in these places is really poor. The doctors in the villages and far-flung areas, they don't go there, although they have given many, many incentives, pay packages, and things like those, because they have no facilities there. Then they have been asked to do 48 hours per week. They do that in 2 days, and 5 days they are off going clinics elsewhere. So I think it's not just a matter of how much money, it is a matter of policy as well, which is the problem. I think that's where we need to address.
So definitely, you know, the outcomes that you desire have to be met, you know, and it's not necessarily the case that throwing more money is going to achieve the outcomes.
Yeah.
You know.
Correct.
Okay.
Correct.
Can I
So,
just add one more thing to it?
Dr. Zia.
I've said this in a few meetings with the government and the UN and WHO and these people sitting in there, these sponsors. Unless we set up a primary care health system, we are not going to come out of this cycle. You need to provide services at the doorstep for the people. They can go and see their GP, and then, like you do in the NHS or Australia or wherever, that the GP looks after your things. He refers you to lead reading hospital or wherever, So and people seem to realize this, but nothing seems to come out of it. So unless we've got a properly planned healthcare system, no matter what amount of money you put into it. I mean, lead reading has got, for example, 1,800 beds. They can only look after 1,800 patients. No matter what amount of money you give them, they cannot look after 3,000 patients. You need to build the foundations. Unless the foundations are strong, the system is not going to work.
So, clearly more funding is needed, let alone anything else. You need more funding. Has the community of leadership within the medical profession, especially those who are involved in running hospitals, what is the message that's coming from you to the government? Is there any innovation that can take place following the 18th Amendment? Is there any innovation that can take place to provide a significant amount of extra funding for hospitals?
I think it's not, like Latif said, it's not the amount of funding. We were, again, I would say that we were with these SDGs meeting, and there were a lot of money being put into the health system. And I looked at the thing and I said to them in a meeting, look, intensive care units are very hard to run, number one. Number two, there's not a lot of people in Pakistan who can run intensive care units for you. What they had done in the 5-year plan, they put billions of rupees for providing intensive care units in each and every district hospital. Now, I said to them, this money, you spend billions on it, but you won't be able to find the people to run it. So what's the point in spending this money? You can spend this money on other services so that you can improve your efficiency. But these messages to go to the leadership, public leadership, they want to portray to their constituencies, that, look, I've opened up a new hospital, a district hospital, and I've brought in an intensive care unit, and I've done this and I've done that. It doesn't bother them. How is it going to run? Is it feasible? Is it practical to run these, to inaugurate, to bring out these things? So I think there's lack of understanding.
So, Dr. Zia, what that leads me to believe is that if there's a reasonable amount of adequate funding, but we're not achieving the outcomes, then there's something, there's a weakness around accountability.
Yeah.
In other words, if I was talking to a private enterprise and we're investing, I want to have stewardship, proper accountability in terms of monthly reports, in terms of meeting budgets, doing a variance analysis, so that I could say that the KPIs are being met, right? So, we often see cases of millions and millions of dollars being spent in the medical professions, in the medical sector, for buying machinery. I mean, I think MRI machinery, CAT scanners, they cost millions and millions of dollars.
Yeah.
And they need a system of support. If we buy a fleet of ambulances, those ambulances cannot just last for 1 year. They have to last for 10 years.
Yeah.
Yeah. But we don't have the accountability or the systems to maintain those particular valuable pieces of machinery. So, what has to be done, at a leadership level to provide that level of accountability? Professor Latif?
Can I just come to your first question earlier as well about,
Yep.
I think there is a misconception amongst the government people and public at large as well, that for some reason NHS, or in our case, the health services, a lot of money is thrown at them and nothing comes out of it. I think this is a misconception. Healthcare industry is very important for establishing or stabilizing economy, as we very well know. It not only creates jobs in the health sector, it by innovations it can produce a lot of money. And in Europe, it's about just the medical equipments. They produce almost like 10 billion euros every year to the economy. They put that into the economy. So, and it's not just healthcare where we produce jobs. It is other services that create jobs because of the procurement by the health services as well. So there are lots of factors actually which will add to the economy. It's not economy drainer, it is economy provider basically. And that is where the people get deceived with this preconceived ideas which are wrong really. Coming to the next question as to how we going to sort this particular problem out. Can I just give you an example of LRH, where this is a public hospital and treatment is free. We charge nominal sum of 20 rupees per patient. Basically, we give them this a sheet of paper that is for 20 rupees only. But if I give you figures of these last 3 or 4 months that we have lost the money, you'll be surprised. It is almost like 16 crore rupees we have lost in different, coming from different sources. And as you just suggested, MRI and CT scan are very expensive. But we have innovated ideas where we get actually revenue back by many different sources. Labs are one of the big providers. And IBP, we have started the institutional-based private practice, which is earning us quite a bit of money, and it is an innovative thought by the MTIs, where the doctors do private practice inside the hospital after working hours, and then they can operate and admit the patients. So a lot of revenue is being generated. So there are so many different innovative ideas. Innovation in pharmaceuticals, for example, will add billions to your economy. Innovations with equipment, surgical equipments and other equipment will add billions to your economy as well. So it's not just, as I said, draining the economy, but it's actually, if utilized properly, it can add billions to your economy as well.
So that's a very interesting point, because effectively what you're saying, it acts like an economic injection.
Correct.
That if the government builds more hospitals, invests more in the hospital infrastructure, that it actually acts as a catalyst for the economy.
Correct.
And certainly, we can see that in the British national healthcare system, following the end of the Second World War, a significant amount of money was invested in the national health sector, in hospitals, and therefore the health sector is a significant employer, but it also has a multiplier effect on the economy as well. Yeah.
Correct.
Yeah.
Great. So, but part of this, let me also bring in the accounting side as well, because a lot of the, the long-term planning, a lot of the strategic planning, the budgeting, also involves people with a financial mindset. How often, as two leaders of significantly big hospitals, how often, do you partner with people with a financial background in order that the financial strategy is aligned with the health strategy? Dr. Zia?
We've got, I think it's KPMG who does our auditing, and they advise us and all that. We've got a chartered accountant with us as the head of finance. But overall, I think financial planning is not the forte of healthcare institutions in Pakistan. The projections, if in the West, if you're starting up a hospital or even a government hospital, one of the hospitals I worked in was funded by the government, but they had their own board of governors and they would look after it. So they would have their own projections, for this year we'll do this, next year we'll do this, and so how will we finance all these things? That kind of planning is lacking here. The other thing, which tax evasion is a big thing in Pakistan. And when I speak to my friends, I tell them, all these years that we've been abroad, we just didn't have to worry about anything. You just pay whatever is due to you in taxes and all that, and everything is clean. And people, medical profession seems to be scared of the departments and the taxation system. Most of them would say, yes, we would like to do it, but we're not comfortable with doing it. So, I think in Britain and Australia as well, they give you certain allowances and these things, and you can claim your expenses. So we don't have, to my knowledge, we don't have that kind of system in Pakistan. So for people to come into the tax net and take some benefits from it as well, that needs to be worked out. And then the financial planning in terms of if you got an MRI, everybody wants to have the latest MRI, and you cannot, it doesn't make any sense to have 6 or 8 MRIs in one city, so you can plan it that way, that you can share services, so that way you can provide a lot more services and people can benefit from it. So that part is not there. I would be thinking, Northwest is the only place and it should be top notch and nobody else should have things that I have. It should not be that way. I think we should be able to share our services, lead reading or Khyber Hospital or Hyderabad Medical Complex, because we are not rivals to each other. We are complementing each other, So that thought process has to come in. Unfortunately, we are lacking that. Everybody is very proud of their own institution and they want to work on that one. There's no collective thinking, how can we improve the entire service? That's what we need to do.
So who has to lead that? Who has to sort of lead it so that we can get to a point where there's proper oversight? Who's going to do the leadership of that?
Unfortunately, if you look at the West, if you get somebody as a health minister, they would have some background in there. They would have some understanding of that. The bureaucracy that is running the health system, they would be trained in the health system. Here it is not like that. There's some people who have got a good sound background in health, but it's not always the case. So it has to come from political and government sector to sort of take people along. And unfortunately, I went to these meetings and I sort of worked a lot on it and I sort of gave them ideas. But at the end of the day, the person who's signing the paper, he is going to say what he wants to do. Yeah. So primary healthcare, everybody is saying we should develop primary healthcare. Everybody say yes, we should develop. But in the end, nothing comes out of it.
Yeah.
So it has to go into the policy system, the policy making.
Yeah. Professor Latif, I was basically trying to think about, how the finance professionals in the private sector, within industry, within financial services, are increasingly playing a role of business partnering. So that means that the finance team, the finance function, headed up by the CFO, is totally integrated in the long-term strategic planning, as well as any other commercial and non-commercial opportunities. How far within a government hospital can you rely upon sort of partnership with the finance team? उनकी capabilities हैं आपके साथ बैठ के एक long term vision देखना और आपके साथ बैठ के एक strategy बनाना.
I can just say about LRH that we have very robust finance department. It's a big department we have here, and we also have a very robust internal audits, and we have set a lot of monitors along the way. Every service is monitored very carefully. We are very sensitive about the issues of misuse of public funds. I'll just give you an example. When Corona started, initially we were suffering because we didn't have the PPEs to protect our healthcare workers. And then we found that a lot of it was being misused. And I came to know about it. So I took personal charge of PPEs and monitored it very closely and regularly with major improvement of that. So that is our own LRH. And as you are aware that Professor Burki is our chairman of the Board of Governors, and he is also in the United States as a doctor. So he has a lot of experience which he puts into the MTIs and now all over Pakistan. As far as the public-private initiative goes, I think it's an idea that has been well tried, almost like 200 years ago in the United States. It started off there as well. There have been issues with it, as you know, in the United Kingdom, in NHS, they call it PFIs, I think, where you have public and private integration, where the private sector looks after the infrastructure and services, and the facilities are owned by public authorities. So I think it's a good initiative. But there have been a lot of misconceptions and misunderstanding regarding it, because a lot of profit has been going down the private sector and public sector have suffered, but it may not necessarily be true. I think it's a two-way affair, and I think it is something that could be tried in Pakistan as well.
My own belief is I think people are, are genuinely willing to pay taxation. Dr. Zia mentioned tax evasion. I think people, again, are willing to pay taxation provided they can see the tangible impact it has on public services.
Absolutely.
If a tax-paying citizen would want to see a good public sector education, they would want to see good public sector health, they would want to see good public sector security, police force, and unless they can see the tangible results, they would not be a willing partner. They would not have that social contract with the government to hand over their tax because they don't see a return. And therefore, we see the private sector grow and grow because they can provide the services. We have private health, we have private education, we have private police force, security, etc. So there's a parallel economy, going on there for people who can afford it. But abhi tak mujhe nahi nazar aa raha hai that the public sector can provide the services that people really want, and I don't see how that's going to be done in the very short term. Because अगर कोई नया tax आता भी है, for example, if tomorrow we add on another 5% to GST, and we say this extra 5% will be dedicated to providing better health service, how are we going to show that?
Yeah.
You know. So let me bring in some जी डॉक्टर ज़िया आप बताएं.
Please go on.
नहीं मैं एक्चुअली क्योंकि बड़े लाइव कमेंट्स भी आ रहे हैं, मैं उनको भी आपके साथ कुछ शेयर करना चाह रहा था. Mazhar Abbas is very shocked that only 3% of the GDP is given to the health sector. You know, so ये मेरा फिगर नहीं है, ये तो मैंने वर्ल्ड बैंक के वेबसाइट से उठा के आपसे शेयर किया है. So you know the other countries are contributing much larger amounts of their GDP. Actually, South Asia में यही लग रहा है कोई 3-3.5%. The only exception in South Asia, अगर अफगानिस्तान में अब अफगानिस्तान में GDP तो उनका कम ही है, लेकिन वो 12% अपना स्पेंड कर रहे हैं on public health.
It used to be 1.4% a few years back. It it's gone up dramatically to 3%. It used to 1.4%.
Right. So the other questions are, my suggestion, Mohammed Ijaz, my suggestion would be to build a population's trust to get treated from their nearest hospital instead of traveling far and putting burden on larger hospitals.
Yeah.
I would like to ask any of the panelists how population's trust can be built. And my other question, how the productivity of healthcare department is measured within the current budget. तो एक करके लेते हैं. जी, Professor Latif.
Ji, if I can just say about the people coming from far-flung areas, they not only have to travel the distances and all the difficulties that go with it, they spend a lot of money. And when they come to tertiary care hospital, all they are given are straightforward medications for straightforward symptoms, which could be done in the villages. So we have identified this problem, and what we're going to do, we have already started, is telemedicine. So instead of these people coming all the way from Swat or Dir or Dera Ismail Khan, we have now regular clinics whereby we take the specialists to the doorsteps of patients, where they history is taken and can also visually examine the patients by links, satellite links, etc. So I think that is an initiative. It is an innovative initiative in public sector in Pakistan, and we are seeing that the numbers of patients that we are trying to get in touch with us is increasing by the day, and we have decided that even corona or no corona, we are going to continue with that. So that's part of initiative from our side. So regarding the trust, I think we have to develop the trust by involving the public, by involving the public and the patients in their own care. I think that's where we are lacking. I think the doctors are overburdened here, because every doctor sees close to between 300 to 500 patients in a clinic in a day. And this is incredible. When I was in the United Kingdom, I would see about 30 patients, maximum 40 patients in half a day. And then I would have my juniors with me help as well. So can you imagine that these guys go straight to the treatment or management of patients rather than spending time with the patient and the family and giving them all the necessary information? I think part of the problem of mistrust is the lack of communication. I think that is something very simple that can be dealt with. The second thing is, patients will die, patients will have complications. As we know, all the hospitals have this. And if you have robust communication with the families and you keep them in touch all the time and keep them updated, I think it develops trust as well. So I think some of these issues can be sorted out locally amongst the health fraternity itself. In other places, you may require some money and some policy making from the government. I think that is a combination of these factors, really.
Great. Thank you, Professor Abdul Latif. I think we've now approaching about 3:56. We've just got another 3 minutes. Have I got any more questions in the comments section? Maqbool Ahmed says, thank you for arranging these frequent webinars. Thank you, Maqbool. We've talked about the spending levels. So I think we've covered a lot of the hospitals. Ashbeel John says, sir, the hospitals in Pakistan were already overcrowded, especially the government hospitals. If the country was prepared for this virus to hit, which it was and will remain ignorant, there was nothing that could be done. I think a lot of even the highly developed countries are also struggling, you know, with the pandemic. It's not just Pakistan. A lot of this was learning on the job. Would you not agree?
Yeah, absolutely.
Could I just, I'm sorry, could I just take a minute to answer that? I can only give you experience at LRH. As you're aware, we are the biggest hospital. We have 1,800 beds. We have so far contributed 240 beds just for patients suffering from corona. And we have intention to increase this to 535 beds. Currently, our ICU bed strength is 44, which is quite a decent strength. And we are in the process of increasing that to 206. And 206 beds in one hospital is unheard of even in big hospitals in United Kingdom, Europe, and United States. So this is not a bad effort from a public hospital. And we have committed ourselves almost 500 staff out of 5,000 who are directly involved in 24-hour care of these patients. And we have had more than 350 positive corona staff amongst the lot here. So there are a lot of sacrifices going on. And believe me, at the start of corona, when we were suffering from a lack of PPEs, doctors donated lakhs of rupees just to buy these PPEs on the black market, basically for the sake of the patients. So there are lots of sacrifices by the hospitals. A lot of positive things have come out of it. We have started telemedicine. We have started tele-lists with United States of America, where we do ward rounds every day on intensive care patients from experts in the United States. We have had links with Wuhan province, China, where it all started. And we have had so many positives. Intensive care management has transformed in this corona pandemic here. We have developed triages that were unheard of before. And there are plenty of positive things coming out of it. And that's what we are taking from this adversity, is take the positives for future, inshallah, as well.
Great. Thank you very much, Professor Abdul Latif. I think just to close off, something on the lighter side, I mean, we've got young people listening to this conversation. You know, in my days when I was young, it was said that a healthy body means a healthy mind. You know, that if you invest in your health in your younger days, it will pay you dividends later on in life. Dr. Zia, on a close, what advice would you give to all the young listeners today in a healthy lifestyle and how that contributes to a healthy mind?
I think, you know, coming to the end of this discussion, we need to look at out-of-the-box solutions. You know, we need to involve people like yourselves, you know, international agencies, to work out and chalk out the way forward. You know, for the younger lot, I mean, our lifestyles are not very healthy. You know, the way we eat, the way we sort of, you know, the way we have our lifestyles. You need to look after yourself. You need to look
Yeah.
after your body, you know, because the life expectancy is increasing, and you don't want to be sort of struggling after 30s or 40s. You know, you've got a long way to go. So you need to look after yourselves. You need to look after your bodies. You need to look after your mental health. Mental health is one of those things which we tend to keep ignoring. And in our society, there's a lot of strain on mental strain on everybody. We are trying to please everyone. You're trying to please the friends and the relatives and all that, and we don't seem to realize that this is giving us problems. You see, look at the number of people using sedatives, hypnotics, you know, tranquilizers, these things. Everybody has got them at home. These are bad for you, you know. And if you need help, there's no harm in going to a psychologist or a psychiatrist for psychotherapy, whatever you need, you know. So the youngsters, they need to look after themselves, and they have to look after their health.
Great. Thank you very much, Professor Latif. Final message to the young people listening.
I always want to be positive in adversity as well. When was the last time that your parents were at home with you for straight 2-3 months? Take advantage of this, build your relations, take a rest, because we have all been working so hard. We never looked after ourselves as well. So it's time to rest, relax in a way with your families, and build relations. Thank you.
Great. Thank you very much on behalf of the ACCA community. So I want to thank you very much. Bahut shukriya aap dono ka. It's been wonderful listening to your vision. Let me thank you for all the hard work and the mission that the doctors and the nurses and all the ancillary staff within your community are giving at this, at this time of the pandemic. And Allah Miya aap sabki khidmat kare, aur Allah Miya हम सबको आगे बेहतरी की तरफ लेकर जाए. Thank you so much.
Thank you for having us.
Assalamu alaikum.
Yes.
Assalamu alaikum.